This is the therapist office, right?
Oh, hi! I'm sure you've already been told, but we have to have this mandatory counseling session just so that we know what we have to work on before you get to meet everyone else at the Woke House. And before we begin your psychiatric assessment, my pronouns are he, she, they.
Oh, do you have a name too, or just the pronouns?
Oh yeah, I'm Dr. Larson. Here you go.
So is it Alexandra or Alexander?
Oh, I mean, that really just depends where I feel I am on the name spectrum that day. For example, today I feel more like an Alexander, but that doesn't really matter because you're going to be calling me Dr. Larson.
Right.
Just make sure you don't forget my pronouns. Okay? Now let's take a look at your file.
You have a file on me?
Of course we do. Now it says you use she, her pronouns. We're going to have to work on that. Oh, and there must have been some sort of mix-up. It says you don't have any psychiatric medicine prescribed.
No, that's correct. I'm not taking anything.
Yeah, that's funny. It's nice to have someone around here with a sense of humor, but I really do have to fill out the medical records because someone obviously made a mistake.
No, I'm serious. I don't need medicine.
That explains a lot. No antipsychotics, no SSRIs, no mood stabilizers, no benzodiazepines, nothing. This must be the culprit of all the behavioral issues you have, all the misgendering you've been doing.
Yeah, but I don't have any mental health conditions, so I don't need to take anything.
Look, Misha, you are a Gen Z woman living in a sexist, transphobic, racist country like America. That's enough trauma to make anyone go insane. So we're going to get you on all the right medications, and you're going to feel a lot better. I'm going to put you on, let's see, Valium, Prozac, sure, ooh, Xanax. And these will help neutralize your condition so that we can correct you. Now, of course, like any therapist, I have my own personal values and biases.
You don't say.
But I am committed to providing a safe, inclusive, and non-judgmental environment for all my patients. Granted, they don't say anything I disagree with, of course.
Naturally, yeah.
Okay, so let's start with some talk therapy.
Shouldn't we have done that before you prescribed me the medication?
You know, you ask a lot of questions, which just further proves how important it is for you to take your medicine.
Okay, just last question then, if I may. Where did you receive your medical degree exactly?
Oh, see, I received over 5 years of psychiatric training on TikTok, where I actually diagnosed myself after going through all the hashtags. I found out that I have DID, because sometimes I talk to myself, and also I have autism, because I really like fidget toys.
Very inspiring.
Isn't it? Now, let's move on to the ink blot test. Just tell me the first thing you see.
Like 2 people in the middle?
Let's see what that means. Oh, okay. It says the correct answer is oppression.
What?
That's okay. Let's go on to the next one. What's the first thing you see?
2 rabbits in front of each other.
No, this one is communism. Yeah, this one.
Somebody standing with their arms out.
You should have said body positivity. See, we have our work cut out for us, but don't worry, that's why I'm here. Now tell me, how often do you question your gender identity? Would you say it's once a day, twice a day, or 3 or more times a day?
Is 0 an option?
Misha, this is a safe space. You can tell me how you're really feeling.
I'm serious, I don't question my gender identity.
You know, that reminds me. I was just questioning my gender identity during my lunch break because I saw this really cool haircut on TikTok, but it had the hashtag agender underneath it, so I guess I have to come out as agender again.
Okay.
Yeah. Anyways, I'll just put once a day. Oh, and you should really have these. I'm selling them at a discounted price. Here you go.
These say sample not for sale.
Yeah, but you know how expensive a trip to Tuscany is this time of year? You'd really be helping me out, and it's a really good price.
Right, but I don't need hormones. I just told you I don't have gender dysphoria.
Misha, it is 2023, okay? No one needs to be diagnosed with gender dysphoria to be trans. That rule was probably created by some old rich white man anyway, so why would it matter? If you say you're trans, and go ahead and pay me for that.
Right, but I'm not, so...
Fine. I'll just put gender questioning. Now, what is your relationship with your birthing parent?
My mother? Good, we're close.
And how did that make you feel?
I said we have a good relationship.
Oh, sorry, not used to that answer. And what are their pronouns?
She, her. She's my mother.
Well, no wonder you can't accept the fact that gender is on a spectrum. You've had no strong non-binary role models in your life. Okay, now any past or current mental health concerns?
I mean, I guess I've been a little stressed since I was told I would either have to come here and be corrected or be canceled and never be able to graduate or get a job. Other than that, no, not really.
Great! And any past trauma including sexist remarks?
You're asking me if hearing sexist remarks has traumatized me?
Yes.
No.
Happens all the time to my patients. Or fatphobic remarks?
Excuse me?
I'll put no. You know, now's a good time to think about how you made poor Emily feel when you misgendered them. You know, I was misgendered once. I didn't shower for a week. But it did allow me to make a really cool story time for TikTok. I gained like 10K followers. I was really proud of myself. You know, my parents never accepted me, and it was just really nice to get all those compliments and that validation. Also, part of assessing your mental health includes assessing your speech, your mood, cognitive function, appearance, which, by the way, is kind of bland. Have you thought about putting some fun color in your hair? It'll help you fit in with the rest of the members at the Woke House.
I'm okay, thanks.
Are you sure? Because it could be a lot of fun. Like just last week, one of the instructors here and I, we did this whole green hair moment during Non-Binary Spirit Day. I really feel like you should ask yourself why you're so boring.
Well, I know this isn't the case for everybody, but I do think a lot of people present a certain way to hide who they really are, because it's scary not knowing if you're going to be liked or accepted by the rest of society, especially teenagers who are still finding themselves, and, you know, they go through all these different hairstyles and hair colors and piercings because they want to feel special, and it's scary to be considered bland or different in a society where not having some silly set of pronouns or some complicated identity makes you fall out of the norm.
Well, if you change your mind, they have free box dye at the house, so. Okay, so based on the gathered information, I would diagnose you with ADHD, OCD, BPD, I'm getting some bipolar too.
Really?
Yes, also ASD and PD.
Wait a second. I'm the narcissistic one? You couldn't go 10 minutes without talking about yourself or your identity when this is a session meant to be about your patient.
Listen, I'm not the one who thinks it's okay to misgender other people without any regard for their feelings, so yeah, I would say you're pretty narcissistic. And as for the treatment plan, I've already prescribed you your meds. There's also going to be group therapy in the future, CBT. Now, it's also important for me to establish a therapeutic relationship with you where you trust me and my judgment so that we can make you into a inclusively inclined individual. So, any questions or concerns?
Yeah, quite a few actually.
Oh, sorry, our session's over and I do have another patient, but you can go meet the others and I'll see you at the Woke House, okay?
Okay.